September is Suicide Prevention Month, a time to raise awareness, reduce stigma, and connect people to life-saving resources. Communities across the country are also observing Suicide Prevention Week this week and World Suicide Prevention Day on Wednesday. Heidi Pritzl, the Suicide Prevention Coordinator at Aspirus Health, says awareness starts with recognizing the warning signs. Heidi?
I would say there's several key warning signs when somebody is struggling with suicidal ideation. And some of those include loneliness, feeling like a burden to others, wanting to withdraw from friends or activities, and we can even see changes in sleep or appetite. And then there's also some more subtle warning signs that we pay attention to, such as an individual who may be calm after a period of distress. And the key message is really being aware of those warning signs, understanding them, and stepping in as soon as you identify any warning sign that we may have listed.
What advice do you have for someone who wants to start a conversation with a loved one they're concerned about but doesn't know how to begin?
Through empathy, through compassion or curiosity. Are you okay? And identifying one of those warning signs. Are you okay? I've noticed that you haven't attended a dinner with us that we usually go out on Wednesday nights, and you weren't present. I'm concerned with you. So not only are you leading with empathy, you're also identifying that warning sign that may have felt distressing to you.
What role do healthcare providers like Aspirus play in identifying and supporting individuals at risk for suicide?
Our Aspirus healthcare providers play a crucial role in identification of individuals who may be leading into a mental health diagnosis or possible suicidality. I call them the first responders. So when we think of our primary care providers, we think of our emergency rooms or specialty care, or even in mental health. And knowing the warning signs, all of our providers are trained in identifying warning signs. They are trained in screening for various mental health diagnoses, in addition to suicide risk assessments. So once they complete a risk assessment within Aspirus, they can identify that level of concern for that individual and then develop an appropriate plan of safety for that person. And once that safety plan is developed for the individual, that provider then is able to educate them on a pathway of connection.
How can families, schools, or workplaces create environments where people feel safe discussing mental health concerns openly?
When I think of those three areas, I think of systems approach. So I think of school systems, work systems, as well as family systems. And I think that begins with leaders. So that can be parents or caregivers in a family, or your leader of your organization, and really practicing full wellness. So that's brain and physical health, so mental and physical health. And we really want to start within the system and showing that sense of vulnerability, that leader speaking about services they may have used, such as employee assistance or taking time off to be with their family. So they're mirroring an act of mental wellness to their employees, and same thing in families. You know, I think of when I go home, I do a check-in with my family to tell them what level of stress I'm at and what I may need prior to making dinner or helping with homework. So we can mirror that wellness within our own homes.
What can each of us do during Suicide Prevention Awareness Month to help reduce stigma and promote mental wellness in our communities?
We honor Suicide Prevention Week starting the week of September 7th, and World Suicide Prevention Day is September 10th. And what happens across the nation on September 10th is individuals light a candle for those that they have lost by suicide. And that's a way of honoring the individual, just like we'd honor anybody else who has died from any other illness. Throughout the week in our communities, there's several different initiatives that go on. I encourage people to be involved in those initiatives within our communities.
Thank you, Heidi. Stay with us and we'll be right back after the break.